Welcome to India's second Metabolic Health Conference. My name is Prasanna. I am a metabolic health coach and a proud member of dlife.in, India's oldest, biggest, and the only award-winning low-carb platform. Shashikant Iyengar and Anup Singh bring to you this historic and scientific feast from India titled Metabolic Therapies. Let's meet our very special guest for this session, Dr. Don Agcopra. Let me
Hello,
give a
Prasanna.
Welcome, Dr. Don. So let me give a brief introduction to our viewers about Dr. Don. Dr. Don, MD, is a board-certified neurologist and an advocate adherent of therapeutic carbohydrate restriction and reduction, TCR, which is also known as the low carbohydrate healthy fats and ketogenic diet, done in conjunction with or without intermittent fasting for several years for reversal of metabolic syndrome, as well as ketogenic metabolic therapy, KMT, proven to significantly improve many other modern human lifestyle illnesses, including Alzheimer's disease, Parkinson's disease, fatty liver disease, polycystic ovarian syndrome, a number of mental health disorders, as well as certain cancers and malignancies. Dr. Don is the founder of Low-Carb Health Doctor, LCHD, a clinic and research center located in northern Mindanao, Philippines. Welcome, Dr. Don, to this conference, and thank you so much for being here. We are really looking forward to this conversation.
Okay, thanks for having me around again in this second conference. I was there during the first India Metabolic Health Conference last year. It's organized by Shazi and Anup, and it's an honor to be here again with you guys to share this advocacy again.
Doctor, let me start by asking you, can you please explain how the ketogenic way of eating works in the context of treating neurological disorders? Can you just give a brief about being a neurologist? How did you get thinking and advocating and seeing the science behind the ketogenic way of eating?
As I always share it to everyone, not just my patients, I got into this low carbohydrate and ketogenic diet space, and specifically the ketogenic metabolic therapy space because of my own personal and subsequently my clinical experience with my own set of patients. When I say it's both a personal and clinical approach, in my case, that goes back to the fact that, like, for the past 1 to 2 decades, I myself have actually developed metabolic syndrome, and that's why, as I have shared in my platform several times, for quite a very long time, I've been doing an almost perfectly vegetarian kind of diet. Eat mostly fruits and vegetables for so long because that's what has been told to us, including me, during my earlier elementary and secondary school days, that carbohydrates are really important, supposedly and allegedly, for maintaining our energy levels and all that. So that's what I've been doing. And especially since I being a physician and I being the son of a physician, my father was a physician, was a doctor here in the Philippines. He was a family medicine physician. So he had his first heart attack at age of 52. And then he had, I think, 1 or 2 more heart attacks. And then the last myocardial infarction or heart attack that he had was at the age of 62, which was really fatal. And that incident really left an indelible mark in me because I wouldn't like to follow his footsteps along that direction, to have a massive heart attack and succumbing out of it. So because of that, I did my best to really follow a supposedly healthy diet, and based on what I know and what has been taught to us in medical school and in our local and international conferences, supposedly the healthiest diet would be eating fruits and vegetables, the vegetarian, vegan way, etc., plant-based diet. So I did that, but surprisingly, I was gaining weight gradually through the years, and by about 3-4 years ago, I realized that when I was checking my laboratory workup, laboratory parameters, it looks like I had already developed metabolic syndrome based on the 5 criteria of metabolic syndrome. I gained weight. My waistline was already beyond what was the normal waistline. I was already pre-diabetic. That means my fasting blood sugar was beyond 100. And then I had developed hypertension because by that time I was repeatedly having blood pressure readings of about 140 over 90 to 100. Then my triglyceride levels in my laboratory was high, and my HDL cholesterol, which is supposed to be the good kind of cholesterol, was way below the cap. So technically, I was almost a perfect scorer in metabolic syndrome, and that's how I got to ask around my fellow doctors, my fellow cardiologists and endocrinologists, diabetes specialists, if what I was doing was correct, because based on my own analysis and based on what I've learned through medical school and in our conferences every year, it seems like I've been doing the right thing. My diet was okay, but then I wouldn't like to start medications, because that's the main reason why I was doing my best to stick to a supposedly proper diet, because I wouldn't like to start medications, because medications are xenobiotics. They are not a normal and natural part of our body. But then when I was asking my friends, cardiologists, endocrinologists, internal medicine specialists, they said that I should already be starting on preventive medications, including statins, for example, hypertension medications, because that's what the guidelines accordingly are saying. And I knew based on the guidelines I should be doing that, but I was half-hearted in doing that, because I really don't like to start medications. So I did. I dug. I went back to research, because right now it would be much easier because of internet these days. And I went through all the research, what's available in the literature, and surprise of all surprise, I realized that there have been a lot of research articles that have not really been taught to us in medical school and have not been presented to our conferences, especially in terms of dietary modifications in relation to the low carbohydrate diet, and how the low carbohydrate diet is the one that's really technically superior as compared to the low fat diet, especially in addressing the reversal of metabolic syndrome. So after unlearning and rethinking all that, I did give it a try, a bit skeptically at first, because I wouldn't like to have a heart attack like my father, because accordingly, if you eat more meat and more fats, you're supposed to have hypertension, heart attack. So when I started my low carbohydrate approach, using myself as my guinea pig, I did it initially skeptically, but then later on, I realized that everything that I read in the research papers were really true. And in 1 week's time, my hypertension normalized from 140 to 100. It became 100 to 110 over 60 to 70. And succeedingly, after 2 to 3 months of starting diligently the low carbohydrate approach, I reversed my metabolic syndrome. So essentially, that's how all started. I applied it to my patients. That's why I'm saying personal and then clinical. I applied it to my patients, and essentially, I duplicated what I did to myself to my own set of neurological patients. So, like, I'd say it's a 100% effective. Yeah, because
It's
for all those patients,
okay. Yeah, please go ahead. It's all those things. That's what you said.
For all my patients who have diligently and with discipline applied the low carbohydrate diet or the ketogenic diet, I'd say it's 100% successful. The only thing that differs is the level of success. Some who are not as very diligent would have only limited improvement, but for those who really applied it diligently and with discipline, I really see repeatedly very, very significant improvement in terms of reversing metabolic syndrome, as well as certain neurologic diseases that are due to neurodegenerative conditions.
Okay. Thanks for sharing that. And so in the context of, let me move to the next question. In the context of treating and acting as a therapy for the neurological illnesses, such as Parkinson's or Alzheimer's, how effective is the, have you found out these ketogenic way of lifestyle and eating? And as small segue into that is, people usually, there is a conception that low carb and ketogenic is the same. I would like to hear from you. Is it same? Or is it a little bit, there is some difference to it?
Okay, so when we are talking about low carbohydrate diets, so there are different levels of approaching the low carbohydrate. So like, let's say, have you heard of the Mediterranean diet, for example? Mediterranean
Yes.
and
Yes.
paleo diet. So in my opinion, these are already low carbohydrate diets. So like, for example, Mediterranean, it's not really very definite how you define a Mediterranean diet. But then in my own opinion and analysis, the Mediterranean diet works wonders because it is a low carbohydrate kind of diet as compared to the standard worldwide diet, standard American, standard Indian, standard Philippine diet, standard Australian diet, but whichever. So when we say low carbohydrate diet, it may be just a moderately low carbohydrate diet. So like, let's say, if you ordinarily, the entire world, most of us have been used to eating like as much as 50 to 60 to 70% carbohydrate by caloric level already for the past several decades because of the guidelines. So when we say that it's like 60% carbohydrate, it would be not surprising if most people would be consuming as much as, for example, 300 grams of carbohydrates per day. But then if you do something to lower that to, for example, just 100 to 150 grams, for example, that would be, you can technically already call that some sort of a low carbohydrate diet. But for me, it would not be enough, especially when we talk about ketogenic levels of low carbohydrate diet. Because when we embark on the ketogenic metabolic therapy or ketogenic diet approach, the main issue here is that we need to lower down the carbohydrate consumption to very, very low levels, to as much as, like, let's say, less than 30, 50 grams carbohydrates per day, because the primary intention would be for us to generate ketone bodies in the liver, specifically beta hydroxybutyrate, acetoacetate, those kinds of ketone bodies. Because when we talk about ketogenic diet, which we can also call ketogenic metabolic way of addressing these conditions, including neurodegenerative conditions, then our main purpose, as I mentioned earlier, would be the production of these ketone bodies, because not just lowering down the carbohydrates, because these ketone bodies, based on studies, even way back to the early 1920s, these ketone bodies have been significant in helping many brain conditions. And then first and foremost, I would like to emphasize epilepsy or seizures, or recurrent seizures, epilepsy or seizure disorder, because in the Mayo Clinic, they have already have documented that since the early 1900s in terms of really doing something significant to control, especially those epilepsies that are hard to control. So the first important indication for the ketogenic diet based on our neurologic would be intervening epilepsies. So because of these ketone bodies that are supplying the brain as fuel in lieu of glucose, for example. So I think the main issue here is when it comes to ketogenic diets, our focus would be the production of these ketone bodies to be an alternate fuel for the brain. When we are in a state of nutritional ketosis, then our brain mostly runs on these ketone bodies instead of glucose, and that's where the significance lies.
Okay.
The replacement of glucose with ketone bodies for the neurons.
Okay. Understood.
Right.
So just to state that you said it is early 1900s. This was significant literature is there, is it?
Yeah.
Okay. So I just wanted to point out that this has been there almost 100 years. So thanks. And I believe you have some information to share. So with a little bit more of scientific studies and data backing the ketogenic diet efficacy, right? So would you please share with us? We have about 20 minutes with us, 20 to 25 minutes. So
Okay.
I would request you to please share your screen so that we can go. You can present that, please.
Okay. So hold on a bit. Are you seeing my screen?
Yes, it is visible.
Can I run my slides? There you are. So this is the slides were part of my usual presentation before in terms of low carb for the brain. So I'll just show to your audience some important things. So this one, as we were talking earlier, metabolic syndrome. So metabolic syndrome in my specific advocacy, why I as a neurologist have been really passionate about doing the low carbohydrate diet for my patients and ketogenic, especially ketogenic therapies for my patients. My main advocacy is focusing on the reversal of metabolic syndrome, because metabolic syndrome, which is, I think, many of your presenters in the past 2 to 3 days have already mentioned metabolic syndrome and insulin resistance. So these conditions here, like heart disease, lipid problems, specifically hypertriglyceridemia or elevation of your triglyceride levels, hypertension, type 2 diabetes, dementia being a neurodegenerative disease, including also cancers like, I think Dr. Phillips mentioned something about, for example, gliomas, glioblastoma, multiforme earlier, then polycystic ovarian syndrome, fatty liver disease that is non-alcoholic nature, or what is currently known as metabolic syndrome associated liver disease. So these are significant offshoots of metabolic syndrome, which is primarily due to insulin resistance. So I think we need to talk much about insulin resistance. Many of the presenters have already mentioned this, the development of insulin resistance. The main reason why I emphasize this, because in the World Health Organization, the top 10 causes of death, this was 2020 figure, but it's still the same, not just globally, but I think this also applies to India. And I know this applies here in the Philippines as well. So these are the top 10 causes of deaths worldwide. So you can lump them together into non-communicable and communicable disease. So if you look at this blue lines here, these are non-communicable or non-infectious disease. So top 1 and top 2 causes of death worldwide would be your ischemic heart disease or heart ailments, specifically myocardial infarction, or what may be colloquially or in lay person's term, heart attacks, then stroke or brain attacks. Then more interesting to note would be like, for example, Alzheimer's disease and its complications, which is a neurologic condition, and other dementias. Then you have number 9, diabetes, and number 10, kidney diseases. So most of these kidney diseases are complications of elevated blood pressure, hypertension, and diabetes also. So nephropathies or nephrosclerosis. So if you look at this closely, these are actually offshoots or complications of insulin resistance or metabolic syndrome. So technically, just looking at this slide itself, we know for a fact that the number 1 killer today for most people worldwide, leading to early deaths even in their 30s. Okay, we see more and more people having heart attacks and strokes in their 30s now because of metabolic syndrome. So technically, I would say, and I would claim, metabolic syndrome is the number 1 killer in the world today, not just Indians. Okay, so here, these are the corollary to metabolic syndrome. We're talking about the brain in this session, neurology, neuroscience. So I have a list here of illnesses, mostly degenerative diseases like Alzheimer's, Parkinson's, and multiple sclerosis. And as we have talked earlier, also potentially ALS or amyotrophic lateral sclerosis being a neurodegenerative disease to be impacted heavily with ketogenic metabolic therapies. So would you like to go into certain specifics?
Yes, please.
Prasanna?
Yeah. So with respect to the Parkinson's disease and the Alzheimer's disease and epilepsy, which are all the neurological illnesses. So what is the mechanism of action? Can you please, see, people usually have the idea that neurological diseases can be treated whatever we call as conventional medicines, right? So when we are talking about a way of eating or a diet, how does a way of eating affect and improve or give respite to people suffering from these illnesses? And of course, these are proven data, right? That's what you are sharing. So can you please throw some light on that?
Okay, so I was also listening to, in part, to Dr. Phillips' presentation earlier, him being a neurologist as well. So I think Dr. Phillips also extensively mentioned a lot about this being neurodegenerative illnesses. And then, have you heard of type 3 diabetes mellitus? Have you heard of that?
Yes, I have heard, but I believe many of our viewers might be new.
Okay, because when I talk about type 3 diabetes to my colleagues also, even in neurology, most of them haven't heard of that concept. Then even globally known researchers in Alzheimer's, for example, like those based in the US, for example, in significant centers researching on Alzheimer's, and I was asking them about the relationship of Alzheimer's with insulin resistance. Many of them really deny that, that let's say evidence-based fact so far. So it is becoming more and more, let's say, evident. There are many researchers already doing research along this line. So if you Google type 3 diabetes mellitus, for instance, so what will come out is like the insulin resistance of the brain. So in in my honest opinion, these neurodegenerative diseases actually impacted a lot by the development of insulin resistance in the neurons, or what may be otherwise called brain insulin resistance. So I think the primary mechanism why, for example, based on what, I mean, going back to your earlier query with regards to ketogenic metabolic therapies and how are they potentially and seemingly, and based on more and more evidence nowadays, how are they improving the brain, is because of this concept of brain insulin resistance. And there have been, as I said, many research articles coming out on that already. So when the brain is becoming insulin resistant, so that means what has been usually taught to us, that our brain runs on glucose, right? That's what is usually being taught to us, including us doctors, so that if we run low on glucose or we have hypoglycemia, then we supposedly will have syncope, or we may pass out because it's like no more fuel, that is glucose, that's available to the brain, which is before, when I was having high carbohydrate diet, I used to repeatedly have that when I'm hungry already and my blood sugar goes down. So I tend to have this syncope, like, or I feel like passing out because my brain is running low on glucose. And I'm sure most people worldwide have that experience as well. So when we apply ketogenic metabolic therapy to the brain, so when the patient or the person doing the low carbohydrate, specifically the ketogenic diet approach, has already become fat adapted, and there are already higher and higher persistent levels of ketone bodies in our bloodstream. So by that time, the brain mostly runs ketone bodies already, and it's not dependent on glucose. So if that patient or that person is increasingly resistant to the effects of insulin in the brain, and thus the glucose is not any more efficient in fueling the brain, and that patient eventually has developed nutritional ketosis, and the brain has learned has relearned, rather, because I am of the opinion that for a long time already, we as a human species have really been running ketones, have really been using ketones as primary fuel for our brain for a long time, like eons already. So when the brain relearns the use of ketone bodies to fuel itself, then essentially these manifestations of neurodegeneration somehow alleviated and seemingly improved. Like, for example, I had this dementia patient who has already been on a lot of medications, and is severely demented, doesn't even identify her name when I was asking her, and was just mumbling a lot of nonsense. And then I placed her on a ketogenic diet, which is really medically guided, because I give them a list of foods to really prioritize, and foods to avoid, especially those that have moderate to high carbohydrate content. So that patient, when she came back to me after, I think, about a month, I was very surprised, really. Those were among my first few dementia patients on ketogenic diet, because about a month after, when she came back to my clinic, she was already able to identify herself and her name. So I don't usually get to see those kinds of patients before, when I was doing the regular neurologic approach, which is drug-based, like, let's say, Alzheimer's disease. You give them medications that are, like, for example, acetylcholine inhibitors, for example. So like all these kinds of dementia medication. I don't get to see them before, because what I usually tell my patients, because that's also what I have been taught in medical school, and as well as in my neurology training, that when it comes to dementia, then the only best thing that we can do is to minimize the progression of the illness. So there is really no such thing as improving the manifestations of dementia when it comes to Alzheimer's dementia, for example. So when I get to see these patients who are technically improving, it's like we have this scoring system for dementia, for example, and then if they're even in the mini mental state examination, for example, before when I was not using ketogenic metabolic therapies, it's like I really haven't seen a patient improving in the mini mental state examination, status examination, out of 30, out of score of 30. So like, let's say if they have very low score, like just 10 to 15 out of 30, and then they follow up with me being dementia patients, what I usually see is that their scores continuously go down. And perhaps as what the pharmaceutical industry has been promoting, this decline would be lessened with the medications for dementia. But then it is quite surprising that some patients of mine actually, if not maintaining their previous mini mental state score, they actually improve like 2 or 3 notches or scores higher. Like for example, that patient was able to identify her name already and can actually follow certain simple commands after about a month or 2 of strict ketogenic diet. So it's almost like, unbelievable times. But when I go back to evidences and research, and I go back to really applying this ketogenic diet in the real world, I see that it is really evidence-based and scientific.
Wow. Thanks for sharing that. And about the success story. And is there any thumb rule? Before going with that, can you please share some of the literature which is already there, research about this, which studies?
Okay, so I made here a list because I was telling you earlier, Prasanna. I do this because I know for a fact that many of my colleagues, physicians, doctors worldwide, are also not very aware about the low carbohydrate approach in terms of the therapeutic carbohydrate restriction, or TCR, to address these illnesses, for example. So that's why I made this list of studies that could give us an idea that there is really evidence in this direction. So like for example, in epilepsy, as I mentioned to you earlier, so it's like 100 years counting already for ketogenic diet to address epilepsy. So these are studies here, human studies. Okay, so this is, for example, a randomized controlled trial, and we also have meta-analysis and systematic reviews, which is a notch or two higher than randomized controlled trials in terms of evidence. So in terms of epilepsy, ketogenic diet really has a lot of studies already to prove that it works. Okay, so I'll just go through them in passing, so we don't have enough time for that. Then these are the mechanisms for epilepsy.
Okay.
So enhanced energy metabolism. This is in relation to the production of ketone bodies, probably in lieu of the brain being dependent to glucose. Okay, anti-inflammatory effects would be important.
Okay.
So in Alzheimer's, we also have this. I proceed.
Yeah. So when people hear ketone, they think fat. Is it okay?
They think, okay, because
ketones and fat. Is it fine to equate them?
Why? What's your number one concern? Heart disease in relation to fat?
I'm just trying to see if there is any misconception, or that's it. That's it.
When you go on a ketogenic diet, of course, it would be a high fat diet relative to the standard diet. So the main issue there, especially in my clinical experience, like most people worldwide tend to be averse to eating fats, including animal fats, because what has been, let's say, propagandized to us for so long is that eating animal fats would be not really a healthy idea, because it would lead, for example, the saturated fats would lead to atherosclerosis,
Yes.
and heart disease, strokes. But then knowing what I now know, okay, I beg to disagree on that, because there is really no evidence to conclude that eating saturated fats from meat products, for example, would be, to our disadvantage.
Yeah. Thanks for clearing that. And yeah, so I just want to touch upon any thumb rule. Certain millimoles of ketone bodies should stay in the for just a thumb rule for people who are suffering with such and who are considering ketogenic way of eating. Just a thumb rule, what they can consider, what they should consider or aim at, should they look for it, or any other thumb rules which might help them.
What I usually do with my patients, because when I go towards specifics, like for example, telling them to maintain this level of ketones in the blood, it's like you need to do ketone level monitoring, for example. So like blood ketones, and there is also a way of doing that using urine, the dipstick,
Okay.
the urine dipstick. So it's like it's like getting lost into the details when I tell them to maintain this level, because most people would have a hard time really monitoring their ketones that way. So that's why I give them a list of foods that would have very low carbohydrates, so that more or less nutritional ketosis would be maintained. So, and then another thing, when we talk about ketosis, many people also confuse it, even doctors, with ketoacidosis. I think your presenters have mentioned that. So nutritional ketosis is far from ketoacidosis, because when we say nutritional ketosis, just like a threshold level for ketosis, or just enough to have ketone bodies to fuel your body and the brain. So like, let's say perhaps 0.5 to 1 millimole per liter would be sufficient level of nutritional ketosis, to as much as 2 to 3, for example, 2 to 3 millimoles per liter. Okay. But then when you do urine dipstick, you can already monitor that. But then I used to do that before, but lately I don't really pay attention much to my urine ketone levels already, as long as I know that I am really eating very low carbohydrate food, because by nature you would really be in nutritional ketosis. That way, if you know which foods to avoid, which foods to stick to when you are doing ketogenic diet.
Okay. And thanks for sharing the various ways of measuring it, and then giving a basic range or thumb rule which might be useful for some of the listeners. Of course, I think it might be case to case. So the range, thanks for sharing that range. And usually, I just wanted to touch upon other neurodegenerative or neurological diseases such as ALS. Is there any evidence, or what is your thought about that ALS, treating ALS with ketogenic?
I am not that very much aware yet. ALS and in relation to ketogenic metabolic therapies, because for one thing, ALS is here in the Philippines. It's a relatively rare disease. I think Westerners have more of it. Okay. But essentially, when we talk of ALS being a neurodegenerative disease, so the mechanisms would more or less be the same as, for example, other neurodegenerative disease, which is due to damage to neurons, like in Alzheimer's, for example. Then Parkinson's. So these are damage to the neurons that are specifically concerned, for example, with higher cortical function, or in movement control, like in Parkinson's. Okay. So I think if in the way I see it, if ketogenic therapy works relatively well in many cases of dementia and Parkinson's disease, for example, because of the mechanism of insulin resistance of the brain, and ALS being also a neurodegenerative disease of the upper motor and the lower motor neuron. So I think if ketogenic therapy is given those patients, more or less the same response of the brain will be evident in terms of the alleviation of neurodegeneration. I think Dr. Phillips mentioned some things in relation to ALS earlier. I was to pay much attention.
I got it. So just as a summary message to all your viewers, and okay, what is one thing which you advise for people who are your patients, your patients, which what's the general theme and advice which you'd like to state to patients and the viewers who are or considering ketogenic way of eating for treating or for alleviating some of the symptoms or better quality of life?
I primarily advocate low carbohydrate diets for all.
Okay.
Not just my neurologic patients. So some of my patients will ask, is it okay if I give it to my adolescent child or my elementary school level child? I am of the opinion, similar to Dr. Ken Berry, Dr. Sean Baker, well, Anthony, I think Anthony Sheffy.
Yes, Anthony
was here. Yeah. I am of a similar opinion to theirs, that it is really the proper and ideal human diet, because babies, in the fetus is really in a ketogenic state. So when they are born, when they are breastfed, they are still in a ketogenic state. So that is the most ideal human diet for all. So don't be afraid to try ketogenic diet, and then do it diligently and with proper guidance, so that you are doing it the right way. Because I have many patients who are supposedly doing low carbohydrate diet or ketogenic diet, but then they have mistakes in implementing it because they are not properly guided. So that's where the important thing lies: proper guidance and the proper way of doing it, so that you will really know if it works or not.
Okay. Thank you. Thank you so much for coming over here and sharing all your insights and sharing your summary. So I'd like to invite Shashikant Iyengar. Yeah, here he is.
Can you please please get Anup Singh also inside? Yeah, Dr. Don, thank you very much for coming again in this second metabolic health conference. This last time you spoke on the general low carb perspective, this time from a neurologist perspective, and I think it's going to help India a lot. So thank you very much.
Thank you, Shashi, for having me again. And
yeah, thank you, Dr. Don. I think we are interacting for the third time in all. And many more interactions to come.